Everybody, Dr. Dennis Ciccone from Ciccone Wellness, Health, and Weight Loss Center. I am so excited you're here for our first in a series of master classes. This is going to be Heart Health Masterclass, and I did have Dr. Casey Kruer, who was supposed to be joining me for this event. However, she had something that came up at the last minute, so she's unable to join us today. So I'm going to go over her story briefly here. I'm so glad everybody's here. I can see the attendees, and I can try to follow along in the chat as well. So if there are any questions, feel free to write in the chat. I will try to answer any of those questions as I'm able to. Obviously, I'm going to be focusing on the material. So if I don't get to your question, you can certainly go to our website and schedule a short 15-minute strategy call with me. Also, we're going to have the opportunity for everybody that's attending today, if this is something that you want to look forward to on a bigger level, we're going to have a free 45-minute new patient call with me. Usually it's $99. So anybody that's here today, there will be a link as we go through. You can get that scheduled and we can meet and talk through things that way as well. But I will try to address the chat if I'm able to. And I'm glad so many of you are here. So let's get right on into it. So Casey Kruer, who was going to be here today, I just wanted to share a little bit with you. So she's a doctor of clinical health psychology. She's 48 years old. She lives with her husband and 3 kids in Florida. She's athlete and health-minded her whole life. So she's always had this healthy mindset behind her life, yet she got very sick, and that's what I want to talk to you about today. She is pursuing a functional nutrition certification. So part of that is because she was so sick and she started to invest tens of thousands of dollars into her health to try to get well through testing and holistic type options. She wanted to start to learn this herself because, one, she started to learn a lot about it, but these are things that she could use for herself and her family, so that she didn't have to pay other providers to be able to be doing this for her. She's been working with our office just over a year, and I just wanted to share a little bit about her story. So in 2018, she was diagnosed with mold illness. Her mold levels were 42 times the level that they should be. That caused tremendous stress to her immune system, toxicity, and her ability to deal with immune system issues. So it caused a lot of sinus problems and how her body was responding. And her body was just not responding in a healthy way. So she needed to, can somebody write in the chat that you guys can hear me, just so I can make sure, just give me a yes in the chat. So when she had come to us, she had been seeing providers. Thanks, Mary. I appreciate it. So she had been seeing providers for a while, and she had spent, like I said, tens of thousands of dollars through testing. And what her and I really figured out was that it wasn't that her doctors weren't doing the right testing and that she wasn't getting better, but they didn't have a very methodical plan to work on one thing, and it wasn't a step-by-step process. So if I've ever talked to any of you before, I talk about it a lot. Like, if you had perfect paint and you were sanding a wall, and you sanded a wall and then you painted it, it would look great. But if you painted the wall and then you sanded it, it doesn't look so good, right? Same products, same everything, just out of order. So one of the things you'll see with our 4-phase approach when we work with our clients is not only do we do the specific testing, but we go in a specific order. So the great thing about Casey is now she's healthier than she's ever been before. She's happier. She still struggles with these things occasionally because, unfortunately, these things are chronic, and sometimes these are issues. But she's had times of energy that have been the best that she's ever had. Another thing, she wants to do another webinar with us on whole body approach to healing and kind of share more of that story with you. So I'm a little disappointed she's not here, because she could have shared that story a lot better than I did, because her energy is just so great. But that's the story. And so many of our patients come to us with a similar story. They're just struggling, and then they make the investment, and then, they see a huge return on that because now they have their life back. So that's what we've been working on with Dr. Casey. So what are we going to cover today? This is a heart health talk. I have been polling my patients and friends and family, and the topic that continues to come up that patients are interested in is heart health. You know, I don't know what the statistics are now, but it's something like 1 in 2 individuals are going to have a heart attack or stroke at some point in their life. So the odds are very high, right? That something is going to happen to us. The question is just when. When is it going to happen to us? And what can we do to minimize so that we're on the healthy 50% rather than the unhealthy side? One of the biggest concerns that comes up with heart health is that it's what they call the silent killer. So most people who had a heart attack today that are in the hospital, they felt great yesterday. And that's one of the really concerning factors is these things can start to get worse and worse and worse, yet you're still feeling really well. I know we have some nurses on the line, because I know most of you pretty well. Any of you nurses, just say that's true, right? Lots of heart attacks come in. People feel fine the day before. Lots of these things, they start to happen around Christmas time. That's where the highest levels of stress are. So we got to keep in mind that just because we're feeling good doesn't mean we're actually functioning good when it comes to heart health. One of the things that we can look at, which is the medical standard, is a lipid panel. This is what most of your primary care doctors are going to look at when they are trying to figure out what the function of your heart is and how they can help to improve this. So we're going to go over that. We're going to understand the lipid panel. We're going to look at it in ways that you've probably never looked at a lipid panel before. The good thing about a lipid panel is most of you, your primary care doctor is ordering those. So you probably have one that you can go look at. And if I cover any information today that feels like it's too fast, or you want to go back and get it, the fact that you are registered or that you're here, you will get a recording of this webinar. So don't worry, you can go back and you can look at it. So pay attention. If you want to take notes, do it, but don't feel like you missed anything or get lost, because you'll be able to go back and look at this later. We're going to look at connections between cholesterol and hormones. How does that work? How is cholesterol connected with hormones? Because most of the patients I talk to have no idea that that is the case or how that's the case. And then finally, we're going to look at some supplements to help support your heart health. My goal here tonight is to give you obviously some free information to go and share with your family, your friends, and have for yourself. Ultimately, that is the free part of the program. There's also going to be opportunities and different levels of getting involved. So if you want supplementation, I'm going to give you that. Then you can work on it yourself. If we have our meeting and you just say, hey, doc, I just want to do some testing, we'll have that as an option. If you want to work with me to go through the whole process, then we can do that as well. So ideally, though, I created this program just to share information and then give options of what to do from there. So let's look at a lipid panel. When you're looking at a lipid panel, most lipid panels are going to cover your HDL, which we will term as your good cholesterol, LDL, which they term as your bad cholesterol, your triglycerides, and your total cholesterol. So the first thing I want you to think about when you're looking at this is, one, we're going to go over what HDL and LDLs are, because I don't like the term good cholesterol and bad cholesterol, because if you didn't have both of these, you would die immediately. So you need cholesterol to live. So we're going to talk about why they term these good and bad and why I don't like those terms. We'll talk about triglycerides. But the other thing I want you to see is that this is an incomplete test. So when you're really trying to look at what is your risk of heart disease, heart attack, stroke, there's many other markers that are really important for you to look at for overall health. Some of them are inflammatory markers, other things like apolipoprotein B, and there's many others. So that's the first thing I want you to think about. The test is very limited. It is going to give you some information, but if you are really somebody that struggles with or has a family history of heart disease, stroke, or you're concerned about this, I would recommend getting with a provider like me or myself and doing a full panel. You can probably do a full heart panel for about $300. So again, insurance doesn't cover it. Insurance covers these basic ones: HDL, LDL, triglycerides, and total cholesterol. And you can probably get those tests done for about $40 if you were paying out of pocket. So think about that just in the difference. Those tests are done so often, and that's what they're used. And the reason those ones are tested is because that's what medications can make a difference to. So these other ones that I'm talking about, these are more lifestyle changes that are required. So let's look at and break them down. So this is the cholesterol cycle. And ever since I learned this, I always looked at cholesterol different. I never thought like this before. I always thought, again, just like everybody else, LDLs are bad, HDLs are good. If my HDLs are higher than my LDLs, I'm okay. If my total cholesterol gets high, my doctor is going to recommend a statin that will help bring it down. And then I have less risk for heart attack or stroke. That's kind of the story. That is totally not true. It's not true. It's lacking in so many different areas. So the primary place that cholesterol is made is in your liver. 80% of cholesterol comes from your liver and your gut. So we're going to look at the liver because this is the main creator of cholesterol. And what it's going to do is it's going to create what they call a VLDL, which is a very low density lipoprotein. That is then going to be converted to LDLs. This is what I want you to think about with LDLs. LDLs are like the Uber driver. And what they do is they drive cholesterol from the liver to the cell. And cholesterol is there to help the body to heal. All right, so I'm going to say that again. LDLs are like the Uber driver. They drive cholesterol from the liver that's created to the cell in order to get it there so that that cell can heal. The reason you need an LDL or an Uber driver is because the cholesterol would dissolve within the blood if it was just sent and put into the bloodstream. So it needs a carrier, which is that low density lipoprotein, which carries it to the cell. Okay. So what then happens is once the cell uses it, the HDL is like the Uber driver that now takes that excessive or excess cholesterol that the cell no longer needs and brings it back to the liver. The liver then converts that into bile salts, and then it continues the cycle. So one of the reasons HDL is seen as the good cholesterol is because it's taking things back. It's cleaning up the area, whereas LDLs are taking cholesterol out to the body. So here's a question, and I want you to start thinking about this. If I were to cut my finger or I were to have some sort of injury, and I want you all to write in the chat when I ask this, what happens to your LDL if you need cholesterol in order to heal? Does your LDL go up or down? I'll give you a second or two to answer. LDL go up or down? Correct. It goes up. So in order for your body to heal, LDLs have to rise. So if you have a lipid panel and your LDLs are high, what I want you to start thinking about as a detective and understanding what we're talking about is that there's a couple things that could be going on. There could be a concern with the liver, or there's an area in your body which requires healing that your body is trying to work through, which is increasing that LDL function. So that's one. I want you to start thinking about that. The other thing we look at on a lipid panel are things like triglycerides. Now, when I look at a lipid panel, I think of the LDLs and the HDLs like we're talking about. They're going to be elevated if the body's in a healing episode. When it comes to nutrition, which is what most people think about with cholesterol, the first place I will look is triglycerides. So triglycerides are going to be more elevated when you are having excessive amounts of refined sugars or simple carbohydrates. So general rule is if you are having your refined sugars or simple carbohydrates and those are not being burnt up as your regular fuel source, you're not utilizing that, then it's going to be stored as fat. So here's just a great rule. If you're looking at your lipid panel and your triglycerides are under 100, which is always my goal with patients, then that means that most likely diet and nutrition is not your primary issue for having an altered lipid panel. Okay, so if your triglycerides are under 100, when you're looking at your lipid panel, think diet and exercise, or diet and nutrition primarily, are not the prime reasons that you are having an issue with your overall cholesterol number. The other thing I want you to think about is if you are having refined sugars or carbohydrates, they are also highly inflammatory. One of the reasons that we have strokes and these other issues with blood clots and heart attacks is more from the inflammatory factors. So cutting sugar and carbohydrates, refined sugar and carbohydrates, is a great thing to do regardless of what your lipid panel looks like. It's just a great move from an overall health standpoint. So I couldn't recommend that enough. I would say this: if you are going to have more carbohydrates or sugars, the best thing to do is to have them before you are going to do some sort of activity. Because if you burn them up, then you're not going to be storing them as fat, and then you're not going to have to deal with that issue down the road. So, tip there. Now, let's look at total cholesterol. So most patients have no idea that this is the way that you measure your total cholesterol number. If it's new to you, write new to me in the chat. It's so hard to do these webinars because I'm talking to a screen. So I love when you guys interact and you write in the chat. So total cholesterol equals LDL plus HDL plus a fifth of your triglycerides. Thanks, Debbie. I appreciate it. So it's like 20% of your triglycerides plus your LDL plus your HDL. So that is where that total cholesterol number comes from. So let's look at this now. So we have this formula which tells total cholesterol, which is the number that they use to determine whether or not to put you on a statin or a medication to help with your cholesterol numbers. What types of things raise HDLs? And this is what I want you to write down. These are the things that raise HDLs. You ready? And again, if you raise your HDL, what happens to total cholesterol? It goes up. Okay, so things that will raise your HDL are things like olive oil or coconut oil, exercise, quitting smoking, or losing weight. Do you get that? So if you're using healthy oils like olive oil or coconut oil, you're exercising, you quit smoking, and you lose weight, your HDLs are going to go up and your total cholesterol would actually increase. So when they say, let's just look at your total cholesterol number or try to get it down, the reason they use that number most often is because that's the number they can affect the most with the medication. They're not being detectives and looking at why each of these things are at play. Again, if you have a healing episode, like your body's trying to heal from something like we talked about earlier, your LDLs are going to be high. So if your body's trying to heal or you're doing some of these beneficial things, all of these are going to cause your cholesterol number to go up. Now, is it true that your nutrition also affects it? We just talked about that with triglycerides, but again, that's only 20% of the amount. So nutrition does matter, but there's so many other factors that play a role here. So what does that do to total cholesterol? We already talked about that. Increases it. Anybody have an idea what percent you can lower total cholesterol with diet or exercise alone? Write it in the chat. I'll give you a few seconds before we move on with that one. Actually, only 10%. 10%. Believe it or not. So 10% is what we can affect our total cholesterol number, diet, and exercise. Thank you for giving an answer, Donna. I appreciate it. Where do we need to look to truly address total cholesterol concerns? So we need to look at the whole body, right? Because if the body is trying to heal, we need to address those concerns. If the liver is not functioning properly, we need to address those concerns. So we need to look in a whole lot of other places other than just the medicine cabinet to get this cholesterol number down. We need to, one, understand why it's up, and then two, understand what steps are necessary to help bring it down. So next thing I want to talk about, and now that we've talked about the lipid panel a little bit, is how is cholesterol tied to hormones? So this picture, which can be quite daunting, one of the tests we do in the office called the Dutch test actually measures all of these numbers. And I go through these with my patients to make sure that they are all normalized and in the right pathway and that they're working optimally. Because if they're not, there's things like risking cancers, the body not being able to heal, lots of symptoms associated with stress or sex hormones or infertility or other types of things. So these are all very important when we're looking at overall health. When we look at cholesterol, which is at the top here, cholesterol is necessary to make all of these hormones. So when we're looking at this, what happens to your level of hormones if your cholesterol number goes down? Again, you need cholesterol to make these. So if your cholesterol number goes down, whether it's with a medication or for any reason, your hormone levels are also going to drop. Because again, think of it like the assembly line. Cholesterol is a starting point. This is what's going to move down the funnel. So if we don't have any cholesterol, no hormones. That's just the way it goes. So what happens to the hormones if we take a medication like a statin? They drop. The most common medication to lower cholesterol number is a statin. Now, biggest side effects with statins, and again, I know we have some nurses on here, but here are the biggest side effects, and you can look these up, and now we're going to get a better understanding of why these are the side effects. One of them is early onset dementia. That's probably the scariest symptom of all of them, especially for anybody that's dealt with dementia or Alzheimer's in their family. These play a big role as a symptom because 20% of cholesterol, we talked about 80% is in the liver, 20% is in your brain. So if you start decreasing your cholesterol, you're actually decreasing some of the energy and how your brain is actually functioning. So early onset dementia. We talked about how it has a big role on hormones. Erectile dysfunction is another one. And then these ones, muscle pain and fatigue. Remember, we also talked about hormones and the body's ability to heal. So if you're decreasing those numbers, LDLs are down, you're not making hormones, you're not going to sleep well, you're not going to have as much energy, you're going to have a lot of hormonal symptoms. The other thing is your body's not making those LDLs as much, so it's not going to be able to get to the cells to be able to do the healing. And then the other things that we see are things like CoQ10 deficiencies or vitamin D deficiencies. So we're going to talk about supplements in a moment, but in Canada, you cannot even prescribe a statin drug without also prescribing it with CoQ10. That's not a requirement in our country, but that is a requirement in Canada for that purpose. So CoQ10 is really important to overall heart health, and it is depleted when you are taking a statin, which is a CoA reductase inhibitor. And when the body does that CoA reductase and it blocks that pathway, it blocks cholesterol, but it also blocks your CoQ10 production. So basically, the medication does lower your cholesterol number by depleting it and crossing off that pathway. What it doesn't do is it doesn't address the reason the cholesterol is high in the first place, any of the symptoms associated with it, and it just decreases all of that allowed. That's why it is such a popular drug, because it is so good at changing the lab. So if you go to your doctor and they go, hey, your cholesterol's high, start on the statin, and then you go back in 6 months, they retest your level is going to be lower all the time. It's very efficient at making that change. What the research doesn't tell you, though, is that there's really no decrease in the risk of heart attack or stroke. If anything, there's a slight increase on those sides. So it's not actually solving the problem other than making your labs look better and probably making you feel better because your doctor is telling you, hey, this is concerning. Oh, now it's good. In reality, they're not really making any changes to that other than just changing that pathway and chemically manipulating it. So let's talk about supplements. Now, for any of you on here that are not current patients or do not have a full script account, so in my office, all of my patients have a full script account and they all get a 10% discount on any supplements. You can certainly go to your full script account and order any of these for yourself or your family if after we went through this, something connects with you. If you are not a patient of mine and you're really not looking to do anything other than maybe some supplementation, write supplements in the chat. And what I will do when we are off here today is I will create a full script account with you with your email and your login information for this event. And I will do a 10% discount for your first order. So all you got to do is write supplement in the chat, and I will go back and I will send this information over to you, and you can purchase whatever you'd like for that first order. This is a Pro Omega. It's a fish oil, but it also includes CoQ10. So if you are somebody that struggles with heart health or is on a statin and is looking to improve overall heart health, this is a great supplement because fish oil is really good for heart health, but it also has that CoQ10. This company makes another brand that we use for patients not on statins, which doesn't include the CoQ10. So that's also an option. But Nordic Naturals makes a great brand. If you are already on a fish oil, here's a little trick that I like to teach my patients is if you are on a fish oil already, freeze your fish oil overnight. If in the morning, cut it open. If it's not still oil, then it's not a high quality fish oil. It should not freeze in the freezer overnight. So you can freeze it overnight, cut it in the morning. If it's still a liquid, then you know it's a good quality fish oil. I've already tested. This company has great products. The other one you can look at, which I'm not going to mention, is vitamin D. Vitamin D, certainly 5,000 IUs a day is a great supplement to do because especially if you're on a statin, it can start to affect those vitamin D levels. And then the other one is Neo 40. So Neo 40 is I met the inventor of this product. He's a brilliant doctor out of Texas. And he created this product. It works with nitric acid oxide. So it works to open up your blood vessels. So the reason it's named Neo 40 is it's recommended for patients over 40 years old. If you are having an active heart issue that you're trying to work on with me, usually we recommend starting with 2 tablets per day. I would just start with 1 tablet per day. See how you do. It's going to help with energy, oxygen levels. Your body's going to do so much better with this product. And again, it's recommended for anybody that has any heart issues in their family, or over 40 that want to actively work on their heart. So great product. And many of my patients use this. Here's a little interesting point. Cancer, which is another one that many patients struggle with, at least 1 out of 3 or 1 out of 2. How many of you have ever heard of heart cancer? Not very common. Do you know why? Because there's so much oxygen that goes to your heart. So in order for a cancer cell to grow, it needs to be, it can't have oxygen. It needs absence of oxygen in order to grow. So if you look at the heart, lots of oxygen going to the heart, very little heart cancers. Just a little tip. So this product actually increases the blood supply to everywhere in the body, but also the circulation to your heart as well. So I am going to put up an offer right now for you guys, and I'm going to share this with you. But anybody on the webinar tonight that either isn't a patient of mine or is a patient of mine and has somebody in their family that they want to talk to about heart health or something connected with them that we talked about tonight, usually it's $99 for a new patient visit with me. We're going to spend 45 minutes going through information to see how I can help you. We are waiving that $99 for anybody that was on this webinar tonight. All you have to do is click the link, schedule a time into my schedule. You're going to see an application come up with about 10 to 12 easy questions. Just fill out those questions. So I have that in preparation for our call. And if we do decide to move forward beyond just like a simple test or some supplement recommendations or something like that, just for being on this webinar tonight, you'll also get a $400 credit towards a food allergy test, which many of you know, and I can talk to you on the first visit why that would be such an important test to start with. You'll also get wholesale lab pricing through Rupa, which is a company we use for all of our medical testing. And then you'll get ongoing 10% discount for all of your supplements through FullScript. So give me a yes in the chat if you learned at least something today. Any of you that I did not address your questions in the chat or you wrote supplements, I will follow up with you after. And also stay engaged as we share this information. You can respond if there's a certain topic you want to talk about. I would love to do more in detail talks like this. Plan to do it at least once a month. So I appreciate all of you for being on here, and thank you so much. And I appreciate you all. Have a wonderful day. I'll leave the link up so you guys can schedule for a little bit longer, and talk soon. Take care.